Hi everyone. So this is my presentation on my proposed telehealth protocol. I specifically looked at mine through the lens of a psychiatric setting because that's what I currently work in and what I'm used to. So why is telehealth important? Telehealth allows for increased access to healthcare, especially in rural areas, which is important in Maine. Telehealth also has shown to be a rapidly expanding area, especially in specialties with a shortage of in-person providers like mental health services. So, though telemedicine and telehealth programs have been around since the mid 20th century, since the COVID-19 pandemic, the use of telemedicine has increased exponentially and will likely remain frequently used for years to come due to its increased access. It's important to decipher between telehealth and telemedicine. Telehealth is kind of the overarching umbrella and is defined as the use of electronic information and telecommunication to support healthcare. This can include things like live video, mobile technology, and remote monitoring devices, while telemedicine specifically requires both audio and visual components to be utilized. Why should telehealth be implemented? There are multiple reasons, including promoting access to resources, improving efficiency without increasing cost, also reducing travel and wait times for patients, and quality of care is comparable to inpatient visits or sometimes even improved. Benefits for the organization and patients include telehealth is a cost-effective means for delivering quality health care, shown to increase patient satisfaction, has potential to reduce healthcare spending by decreasing problems like unnecessary ED visits, prolonged hospitalizations, and potential medication misuse. So for my proposed protocol, privacy and security is often a concern. In an article in the International Journal of Telerehabilitation, these issues are discussed, and it is imperative that a HIPAA-compliant medium must be utilized in order to provide telehealth services. In that same article suggests that best practice includes integrating telehealth services into security and privacy policies, as well as integrating telehealth into the notice of privacy practices. All staff should receive a specific telehealth privacy and security training prior to offering telehealth services. Support and adequate training. Evidence also suggests that if support and adequate training are lacking, that this can inhibit implementation of telehealth services. Providers should be provided with training on the telehealth medium that will be utilized in order for them to feel comfortable and understanding of the equipment they're using. Evidence has also shown that clinicians' acceptance of telehealth and their ability to adapt to new technology is critical in the long-term success of telehealth programs. One way to combat this is addressing clinicians' concern at the start prior to launching a program, as well as providing trainings like previously discussed. So, establishing the appropriate telemedicine visits. UpToDate outlines that not every patient or clinical situation is appropriate. For example, patients lacking adequate decision-making skills or patients who are unable to have privacy should not have telemedicine. Provider and clinic preparation. Providers should be prepared to address their in-person and virtual workflows to minimize problems during telehealth visits. Staff should confirm that patients have the necessary requirements for telehealth, and it should be confirmed that patients understand that their copay and their reimbursement responsibilities prior to having visits. The scope of the visit should also be explained to the patient prior. This can include the length of the appointment, what can be accomplished during the visit realistically, and what to do if the provider is late. Consents should be obtained prior to the visit, as well as privacy expectations being relayed to the patient prior to them having a telehealth appointment. It's required by United States law that consents be obtained prior to any telemedicine appointments. Providers should also be provided with and trained on the technology needed for telehealth appointments. Providers should test audio and visual prior to any appointments. Telehealth visits should also be scheduled back to back to maximize the efficiency and minimize any potential technological errors that could impede on visits. During the visit, the provider should address any privacy concerns prior to discussing private payer information. Providers should speak slowly and pause to allow for delays in transmission. With psychiatric treatment, physical examination is limited, but the provider should note the general appearance, their speech, grooming, and any notable extrapyramidal symptoms. The American Medical Association created a telehealth implementation playbook that creates a framework for a successful telehealth program. After proposing the idea, the steps should focus on designing workflow, preparing the care team, partnering with the patient, and then implementing the practice. The American Psychological Association also created guidelines for telehealth in the field of psychology. These guidelines include ensuring provider competence with technology, making sure ethical and professional standards are being met, informed consent is established, protecting confidentiality of the data, ensuring appropriate security measures, and being familiar with telehealth laws. Telehealth is a vital service to increase patients' access to health care as well as help combat in-person mental health provider shortages. I would suggest that leaders continuously look into ways to increase access to telehealth services in order to increase the amount of individuals able to access health care and improve their health outcomes. Thank you guys for listening to my presentation. Here are my references. I hope you guys all have a great night.